Hello, my name is Ravi DeYoung, paramedic instructor. For my professional communications course at Siena Heights, I'm doing my technical presentation on emotional resilience for emergency medical services. Quick overview of EMS and where it stands. It was founded based on a white paper that was done by the United States Department of Transportation in the 1960s. EMS is comprised of a patchwork of organizations, whether the ambulance service is owned by a private company, small or large, nonprofit organizations, hospital-based, municipal owned by the county government, or fire-based, responding with the fire departments. In the United States, we're only classified as an essential service in 13 states, meaning that there is no guarantee that an ambulance is required to show up in the time of need for someone having a medical emergency versus your house being on fire. You will get a fire department response, or even a police or law enforcement emergency. You'll get the police department response. We're always ready to respond to any medical situation, whether it's an emergency or a non-emergency situation. No matter what type of organization is sponsored by that ambulance service, we all meet the same standards as far as equipment and training for our ambulances. We are there ready to help those in need. Emotional resilience is a topic that is getting closer and closer to my heart because our providers are at increased risk. 37% of EMS professionals have contemplated suicide, which is 10 times the rate of the American adult. 6.6% of our emergency medical service workers have reported attempting suicide, compared to 0.5% for all the other adults. This is according to recent studies performed by the National Association of EMTs, a large professional organization for EMS. Also is the increase of physical risk. 2,000 EMS professionals are injured every year on the job according to the Center for Disease Control. It is 22 times higher risk than the national average for all workers. As you can see, we take these things closely. So what is emotional resilience? Emotional resilience is the ability for someone to be able to manage stress from a known or unknown situation. What causes this emotional trauma or stress in our providers? It's the lack of understanding of loved ones or friends. Constantly asked my hated question, what's the worst thing that I've ever seen? Can never put words to that because it's something that I don't want to have to think about or relive. We see no support or lack of support at our places of employment, thinking, just show up, take the calls, move on to the next call with no chance to process of what we've seen. We're always on alert, waiting for the next call to come in, not knowing what that next call is going to be. Is it we're taking someone from a nursing home to a doctor's office, or are we responding to the freeway to care for someone who's just been involved in a nasty car accident? We're constantly exposed to trauma. We see this trauma vicariously through our patients. We see how they respond and how they're taken care of in that care. We also put a lot of judgment on ourselves. We see a lack of appreciation and criticism from our communities, always being questioned. Why is it so expensive for an ambulance? What do we do there? We never know what situation we're going to walk into. We get very limited information from our dispatch telling us what we're seeing. We work long shifts, averaging 12 to 48 hours on duty. And that takes a toll because we never know when we're going to get the sleep that we need or be able to take that downtime for us. Food, who knows what that is? We're constantly stopping at fast food, gas stations to be able to get that energy to sustain ourselves. So what can be done to help EMS providers build emotional resilience, the ability to better manage their emotions and to be prepared for stress and not have it take as much of a toll? We can start seeing some organizational cultural changes, having that understanding being it's okay to reach out and seek help. having a set of criteria that there will be a member of staff that reaches out after certain calls, whether it's a call involving a child or a death, traffic accidents that have lots of damage or trauma associated with them. We have what we call critical incident stress management teams. Those can come out. Globally, destigmatizing mental health and emotional well-being, saying it's okay for us to reach out and say, hey, we can do this. Spending more time on emotional resilience in our early training. We get none of that in our introductory training. So saying, hey, here's what we can do. Here's how we can help us. And providing providers with toolkits, ways for them to manage their stress or to document how they're feeling and things along those lines. I hope this has provided a high level on emotional resilience and why it is so important for our EMS providers.